Welcome to All Access DNA, the podcast where we explore genes and DNA to understand how they impact our daily lives. Whether you're curious about general concepts or want to dive deeper into the science of genetics, you've come to the right place. I'm Kate Wilson. I'm a certified licensed genetic counselor who has worked for clinics and labs in a variety of specialty areas. And I like to talk to smart people who can explain science in a way that is easy to understand. Whether you're a science newbie or someone just looking to impress people at parties with fun DNA facts, we've got you covered. Let's get started. Hey DNA, it is time for a new episode of All Access DNA. In today's episode, we are talking to Holly Zimmerman about genetic counseling and what it's like being a genetic counselor. Holly Zimmerman, she, her, is the inaugural director of the Genetic Counseling Program at the University of Nebraska Medical Center. Holly serves on the board for the Association for Genetic Counseling Program Directors, and she is an active member of the National Society of Genetic Counselors. Hi, Holly. Thank you so much for being on the show today.
Yeah, thanks for having me.
We wanted to talk to you about genetic counseling and a genetic counselor. So tell me first, what is a genetic counselor and what do they do?
So, this may feel like the easiest question to start, but probably the hardest question. I actually teach students, and this is something we talk about often of how hard this question is to answer, but I'll try my best. So, genetic counselors are essentially people that are trained in genetics and trained in counseling and can support patients and their families when there is either a diagnosis or the chance to have something genetic in your family. And so, genetic counselors work in a lot of spaces. It's probably best for me to focus on my own experience, which is in direct patient care settings, and so in clinics. But genetic counselors can have a lot of roles outside of that. One time at a social gathering, someone asked me, "What does a genetic counselor do? Do they counsel genes?" And I just thought that was a really funny question to ask. So, no, we don't counsel genes, but we do work closely with patients and their families.
So you work with the patients and the families and talk about maybe like genetic conditions or kind of maybe chances for genetic conditions.
Yeah, so I worked primarily in pediatrics. And so we would work with patients where there was a concern for either a difference at birth that required surgery or concerns for development or growth, maybe learning difficulties. And I always said that genetic counselors are kind of like detectives to figure out could there be one explanation for all the things going on for that child or in the family history. And so I think that's one aspect of genetic counseling is working with kids, but there's a lot of other ways that patients may find their way to us.
Okay, so there's a lot of different areas in genetic counseling.
Yeah.
And you mentioned working in the pediatric setting. So tell us how you got into genetic counseling.
Yeah. Um so I was born and raised in Mississippi, and there I feel like everyone talks about you're either a doctor or a dentist or a nurse if you have an interest in healthcare. So genetic counseling was definitely not something I heard of very early on in my interest in kind of pursuing a career in healthcare. When I was in undergrad, I took a genetics course and loved it and did well in it, whereas other people weren't enjoying it as much. And so I just remember having a conversation or with my teacher and just saying, I really am liking genetics. Is there something that I can do where I'm using this in my career? And she said, well, you could do research or this newer field called genetic counseling. And so I kind of followed it back. In Mississippi at the time, there were not any genetic counselors, so I didn't necessarily have the opportunity to really explore it. And some of the amazing resources that are available now were not available then. And so I just filed it back, but I thought, well, that sounds interesting. I worked a little bit more in the research space and loved the people I worked with and loved learning more about science and genetics and molecular biology. But what I realized over time is I enjoyed the research when the people were enjoyable as well. And so I found myself at one point in a research lab where I just didn't have any as many people around me, and realizing I missed that aspect of being able to connect with people. And so I was able finally, at the time I was living in Memphis, Tennessee, and I was in a research lab. And there I was able to connect with a genetic counselor and really talk to her about what she does. She was working in a cancer center, and I wasn't able to shadow her just from limitations of the hospital setting, but I was able to have some good conversations with her about why she loved her job. She talked a lot about loving science, loving genetics, but also the opportunity to meet with patients and connect with them, hear their questions about their family or their new diagnosis of cancer, and help support them in understanding their diagnosis as well as offering them resources. And I thought, wow, that sounds like a really great fit. And so I continued to explore that and applied just about a year after graduating from undergrad, and then was accepted and was so excited. And in hindsight, I can't imagine choosing any other path. And so this has been a really fun and very fulfilling profession for me.
And so, if somebody wanted to become a genetic counselor, it sounds like it's post undergrad type of degree.
Yes, yes. Yeah, so I have a biology degree from or a bachelor's degree basically from a 4-year college. And then I took a year off, not everybody does. And then it's a 2-year master's program. And sometimes it's a master of science and sometimes it's a master of genetic counseling. But it's 2 years after your undergrad degree. And I should add that you don't have to have a biology degree. What's really interesting is so I direct a program now, and we have students who have been music majors. We've had students with sociology or psychology background. So it's really the prereqs that are important, or the required classes before you start a program.
Okay, well, that's good to know too, that it doesn't have to necessarily be a science pathway that gets you to genetic counseling.
Right. Yeah.
And I will also add that Holly and I were classmates in graduate school, which is how I got to know her. So I'm thankful she found genetic counseling, and then after graduate school became the first genetic counselor in Mississippi.
Yeah. So that was an adventure as well. It's funny, when I started the program, I don't know that I ever thought, oh, I want to go back to Mississippi and be the only genetic counselor there. I'll even talk about that. I have to think about that as one day at a time, because I don't know that I ever applied to be the only genetic counselor in a state. But what a great opportunity. I also have to give a huge shout out and recognition to Dr. Omar Rahman, who now is practicing in New York, but was such an integral part of the start of my career as a genetic counselor, and continues just to be a genetic counseling champion. But that was like a really fun time to be a genetic counselor in a state that didn't necessarily know what genetic counselors do, or the value of genetic counselors, and to start at a huge academic medical center and think, like, how do I even start to talk about genetic counseling? And I think what you realize is, in the work that you do and the patients that you see and the information that you can bring to a team or to a patient, that's really what spreads the message of what genetic counseling does. And I think that's why you have to think about it one day at a time versus, like, this is what I did for 4 years. And I say 4 years because we were able to add genetic counselors at that point. And so I was in Mississippi for 10 years. And at the end of it, I think we had about 4 genetic counselors, which was really exciting.
That's very cool, just to build something up and to make it a program that still is in existence to today.
Yeah.
You mentioned kind of working with patients and families, and even healthcare professionals that maybe weren't familiar with genetic counselors. So let's get into what is, you talk about what is a genetic counselor, but why does somebody need to see a genetic counselor?
Yeah. I mentioned a little bit about peds, but I think, you know, I think people have questions about their family history and sometimes don't know where it goes. And just being a patient myself, sometimes the family history form at a doctor's office is not as inclusive and as comprehensive as maybe we would like it to be. And so sometimes I wonder if patients go to the doctor and either click or don't click on the form, or, select things and think, okay, if something was serious enough, this form would capture it. Otherwise, I'm not going to say anything. Or maybe somebody actually does say something to their doctor and their doctor isn't sure where to go from there. And so I've helped where I am now. I help with some of the referral process. And I feel like most commonly, the things that I see that aren't really obvious of, okay, you have a new diagnosis of cancer. Let's talk through, could this be genetic? Or you have, a family history of a sudden cardiac or sudden heart attack. Some of those things that maybe route you pretty straightforward to certain parts of genetics. I think there's a lot of people just in the general population that have questions of, my family member passed away from this cancer. My family member had this, early diagnosis of Alzheimer's. Could that be me? We have a lot of diabetes in my family. Is that something I'm at risk for? And so all of those things I think people have questions about and aren't always sure where to go. And I think that's a growing field in genetic counseling, both thinking of genetic counselors maybe more in primary care, which is sounds amazing, especially for states where there's maybe all the genetic counselors are in a bigger city or in a medical center. But how can patients have more accessible answers as they think about some of these questions? Um, so that's kind of a big thing, I think, is family history and some of those questions that maybe go unanswered. And then I mentioned about pediatrics. I think another thing, another field that we can see is genetic counselors in the prenatal space or preconception space. So that's where patients may have questions either again about a family history, having a nephew or a niece with a certain diagnosis. Could this be something that could come for their children or future children? If something comes up unexpected during the pregnancy, so on ultrasound, there's kind of a finding where maybe there's a difference in the heart or there's a club foot or something like that. There's a lot of families that have a lot of questions. I think the most common one is, why me? Why us? How did this happen? And genetic counselors really can provide information in those settings to help families kind of understand the why behind it and also talk through kind of next steps for potential testing and delivery and things like that. And then a huge area, which might be a little bit more obvious, is cancer. So there are, unfortunately, we do know cancer is common in the general population, but when we see cancer at an earlier age of or an earlier diagnosis, so maybe breast cancer in 30s or 40s, that makes us more suspicious that there can be a genetic cause for that cancer for that individual or in the family. And so there's some questionnaires. I think that can be a common questionnaire on the doctor office visits that I mentioned of trying to assess, are there earlier cancers in the family? Or for a person who has been diagnosed with cancer at an earlier age or period, could be referred to a genetic counselor as well to talk through that, both for understanding kind of that, why did this happen so early, as well as potentially directing treatment for that cancer as well.
So it sounds like family history for sure. If there's things going on there that you might be suspicious about, it makes sense to see a genetic counselor. In pediatrics, you mentioned if people are, if a kiddo is experiencing learning difficulties or has some maybe physical signs or symptoms, that parents are concerned about, are different reasons to go see a genetic counselor.
Yeah.
And once somebody gets in to see a genetic counselor or is referred to a genetic counselor, what happens during the session? So, how
Yeah.
do genetic counselors maybe try to figure out what's going on?
The fun part about that question is just thinking about teaching students now of they are also learning what to expect in a genetic counseling visit. And so we talk about there's certain components of the visit that we're training students to do, and then that helps also the patient understand what to expect. And so for students, and then to think about the patient perspective, the patient would be greeted, and so we introduce ourselves. We want to make sure the patient feels comfortable in the space. We want to, of course, know how best to address them, and we might do a little bit of small talk because we recognize parking could be rough if we're meeting you over a telehealth visit. There's technology involved that can be a little tricky as well, and so we want to kind of see, how was it getting to us, and how the day is going so far. There's a lot more that happens outside the visit, so that's really helpful information to us as genetic counselors to just see, how is the patient showing up today and what else might be impacting them. And we also want to understand what the patient knows about the visit and what their expectations are. So we may say, I understand, your oncologist referred you to come in today, or your doctor referred you to come in today. Tell me what y'all talked about for today's visit, or tell me what y'all talked about for coming to see a genetic counselor. Some patients may have a really good idea or maybe even ask for the appointment themselves, where some patients have no idea why they're there. And that, again, is helpful information for the genetic counselor. It helps us understand, do we need to explain a little bit more and provide background of why they're there? Or are we wanting to make sure that we say, oh, absolutely, I understand that is a concern for you, and we want to make sure we address that. So we probably spend the first several minutes really just understanding the patient, how they're doing and how they're understanding that visit to kind of set up the appointment. Um, almost all genetic counseling visits are going to take a medical history and then a family history. And so for a family history for us, that's a really important tool. We call a 3-generation pedigree, which is essentially like, Kate, if I was taking your family history, I would start with you and I would go to your parents and then your grandparents. I would also ask about aunts and uncles and cousins. And of course, if you have children, I would also be asking about your children as well. And we're just trying to get a visual picture of your family history. And for us, we're trying to see if anything is maybe traveling through the family. It's also helpful for us to hear, sometimes families understand. Like I might say, do you understand that there is something traveling through your family? Or what's your understanding of this diagnosis in your family? And again, that helps us understand kind of your perspective of your family history. We take the medical history depending on if it's prenatal. We're going to ask a lot of, pregnancy related questions and medications and all those things. In pediatrics, we ask a lot of questions about development in school and things like that. And then, of course, for adult and cancer, we're going to ask more kind of general medical history for those individuals. We're basically gathering all that information to put it all together and kind of understand the patient in front of us and their history, including their family history, to see, are we getting any clues that there could be something genetic for this person or in their family that we need to talk through. When I, talk with students, so that's all the gathering the information. The next part is kind of giving information. So the giving information could be explaining a diagnosis if there was a diagnosis made. It could be talking through next steps for testing. It could be, we want to refer for this particular provider so we can get a little bit more information. That was pretty common in pediatrics, where maybe we need an eye exam or we need an ultrasound of the heart to better understand, could this be, could there be a particular diagnosis for a child? So all of those pieces are kind of giving that information. I think a huge part of genetic counselors, and you may already have this sense, is we kind of slow down the appointment. And so it is, I find a lot of times the first time the patient actually has the opportunity to kind of speak and share their perspective and ask those questions. And it adds just a deeper understanding for that patient. So as we go through, our goal really is for the patient to not only understand their, what the information is that we're giving, but also become advocates for their information in other spaces. When we talk through testing, testing might be an option, testing might not be an option, but I think the other important thing is we want, in a lot of our settings, we're not saying this is a test you have to have. We talk through that testing and why it is a consideration and what might be best for the patient to decide to do, whether it's to test or not test.
Hmm. I think one of the things with genetic counseling, like you said, is it's a more in-depth appointment or conversation. It's definitely not a 10 to 15-minute kind of check-in, checkup. So I think it's great that that allows opportunities for patients or their families to get more information. And I thought it was interesting that you mentioned genetic testing kind of towards the end. Like that's not always the primary reason for somebody seeing a genetic counselor. And that's not always the outcome of the session. And so you said it's not always recommended, but can you add a little bit more to kind of how genetic testing fits into a genetic counseling session?
Yeah. So I'll, um, What's interesting, kind of go back to your first question of what is a genetic counselor. I have seen definitions where it's all around genetic testing, of genetic counselors interpret tests and explain test results. And there's such a huge part of genetic counseling that's not always related to genetic testing. So I appreciate that that note. Um, so when I think about genetic testing, there are times where I think I mentioned that early onset of Alzheimer's. There are times where a family member may come to us to talk through a concern they have in the family history, and we talk through how something could be inherited, or we talk through recurrence risk, meaning, because of the person in your family, maybe you have a 50-50 chance to develop this, or maybe you have maybe you're not at an increased risk based on the age of diagnosis in the family. So for that particular person, they may not be what we call the best person to test. So genetic testing is not perfect. And part of genetic testing is you need someone to guide how to do the test. So both which test is the best test for this patient or this family, and then who is the best person to test. And typically, the best person to test is the person with whatever symptoms we're looking at. So that early onset Alzheimer's, and so an early diagnosis of Alzheimer's would be that person is the best person to test, the person with the diagnosis of Alzheimer. But if the daughter of that person came to see a genetic counselor, they wouldn't necessarily be offered testing, but we would talk through reasons why we would want to test the parent of that individual first to then be able to give information to the patient in front of us about their chance to develop this diagnosis. So
Yeah.
that's
I was going to say, because the way I think about it is they're the like informative person, because like you said, genetic testing isn't perfect, unlike what we might see on TV and movies.
yeah. Yeah.
Um, and so we may want to test the person that's showing those symptoms, because then we have the best chance of detecting something on the genetic test. And if we don't detect it on the genetic test, then that means we may not be able to find it in other family members. So,
Right. Yeah. So if we tested that person that had the symptoms and all their testing was negative, unfortunately, we don't have a test to offer anyone else to look for the chance that they could also inherit or have that same diagnosis. So that's a challenge. Sometimes those individuals with the symptoms or the diagnosis are not available. And that's hard because they are the best person to test, but maybe a patient is still hopeful for information. So there are times where either we talk through the information to counsel and say, here's the risk number we have, or here are our thoughts, and we talk through that. And there are times where maybe testing is done and it's not on the best person, but we also talk through the limitations of that testing, of this is not the perfect process, but we want to try to give information, so here's some additional information that we can provide, and we talk through the limitations of that testing. So there are times, and I think about in particular in cancer, sometimes where that person isn't available, and maybe testing happens and it's not, again, the best perfect path, but it's trying to get information, but also educating the patient on those limitations.
and I guess that would be another reason to talk to somebody like yourself, that has this background in genetics, because there are these nuances. It's not binary or an easy formula to say, you have
Yeah,
this, we're going to do this. So there's all
yeah,
these types of exceptions or things going on in the family that need to be looked at
yeah.
and communicated to the patient.
Yes, yes.
Okay. So I think you answered my questions about the session and the testing. One of the other questions that we thought about was to be like diagnosed, because like you said, a patient may come in with some symptoms, but there's not necessarily a known cause, at least at that point. So would a genetic counselor be able to give somebody a diagnosis and say, yep, here's what's causing these symptoms that we're seeing?
Yeah, that's actually something that uh, we stand apart from our kind of partners in genetics, medical geneticists. So genetic counselors do not diagnose, and we don't do a physical exam. That would be for our partners who are medical geneticists, and I'll just say that's basically an MD doctor who does additional training to be an expert in genetics. And geneticists are able to do a physical exam and diagnose. The tricky part is sometimes testing that we recommend or we even order may lead to a diagnosis. And so that's a tricky part where we didn't make the diagnosis, the genetic testing did, but we'll talk through that diagnosis once that diagnosis is made.
Hmm. Okay, so what it sounds like then is that there are probably different things that go into the diagnosis. Like you said, a physical exam, maybe some genetic testing results. You're also pulling in things like family history, and all those things together can lead to a diagnosis. But there is this partnership between a genetic counselor and then the physician that may be a medical geneticist, or maybe in the case of like a patient who has cancer, it might be their
Mm,
oncologist.
right. Yeah.
Okay. So it's really sort of a team approach.
It is. And, this is another area where genetic counseling has grown is working with other types of medical providers. So you had mentioned oncology. There's genetic counselors that work with cardiologists. So maybe a traditional physical exam, we're not going to see anything, but the exam of the heart is really important for helping us look at particular genetic tests. So maybe the heart's a little bit, maybe a certain valve is enlarged or a certain ventricle or part of the chamber of a heart is enlarged. That actually directs different testing for genetics. Same thing for neurology, that maybe a physical exam isn't going to show anything, but the kind of neurological exam, if you will give us clues to what testing may be indicated. So there's a lot of genetic counselors that work with different types of medical providers, not just geneticists, because of what those symptoms might look like.
That makes sense. Okay. One of the more common, popular types of questions I think that we hear a lot about when it comes to things like genetic counseling and genetic testing is insurance coverage, or what's the cost. So, why don't we start first with genetic counseling? So, seeing a genetic counselor, is that something that's covered by insurance?
Yeah, great question. Um, I think it's hard to have a simple yes or no answer, just like anything in healthcare. And so I will say that a lot of insurers have, or a lot of payers, I should say, recognize genetic counselors as billable providers, and that may be covered. It's also subject to your deductible and your out-of-pocket max and things like that. And so it depends. But I think just similar to if you ask me, is an MRI covered or is meeting with the cardiologist covered, it's a similar answer where you need to explore with your plan. But genetic counseling is a recognized field in healthcare.
So, in that case, a patient may need to say, can you give me some of the codes for the visit, and I can chat with my insurance company just like I would if I was being sent in for an
Yeah,
MRI.
absolutely. And it depends on why you're seeing the genetic counselor. Some genetic counselors we talked through, like, might be part of an oncology visit. So it actually might be part of the charge for the entire visit to meet with all the team members. Some genetic counselors work with kind of a high risk OB doctor. So kind of a similar thing where it's all kind of packaged in. Some genetic counselors are billing independently for their visit. So I think asking for kind of how the visit is billed and those codes would be really helpful to explore that.
Okay, good to know. And then with genetic testing, again, not necessarily an easy answer or a yes or
Yeah.
no. So with genetic testing, how does cost look to patients?
Yeah, I think this is an important thing, and I've actually met with some chief medical officers for insurance, and it's such a big field, and so many people are doing genetic testing that for insurance companies, they really want to make sure that everybody's getting the test that they need. And unfortunately, there is some testing ordered that's not necessary, or maybe is excessive, or wasn't informed by a genetics expert. And so, insurance companies, I think of a particular one, have really worked to create policies to ensure that the right person's getting the right test, kind of what we talked about. It doesn't mean it's a zero cost. And so the same thing applies of deductibles and out-of-pocket maxes and things like that. There are some testing that insurance might need a letter of medical necessity. That's also where a genetic counselor can come in to help write that letter to support coverage of that testing. Again, not zero, but maybe going toward that deductible. There are some companies that offer some payment options, and then there's also some institutions that may offer some payment options as well. So let's say it's $500 at the end of the day. There may be a payment plan that an institution could offer to help a patient pay for that. Or it could be that if the testing goes directly to a laboratory, that they also have a payment plan that patients could work through. I should add every institution is a little bit different and every laboratory is a little bit different. That for patients that are covered by Medicare or Medicaid, there may be additional plans in place to help patients have access to genetic testing.
Hmm. I think in a way it's some people hear genetic testing and they think, oh, extremely expensive or cutting edge, but that's really not the case anymore. It's actually being treated very much like any other type of additional blood work or imaging type of study, more than it used to be. So there are options now for coverage, payment plans, things like that.
Yeah, absolutely. And I'll say technology is getting better and better. So there was a time where um, there weren't a ton of companies doing certain tests. I think about cancer testing in particular. So the price was really high because there wasn't as much competition. But now there's more competition and the technology is a little bit different than what we used to use. And so that also drives down cost in a good way.
Good to know. And thinking about, the different nuances and kind of things to think about when considering a genetic diagnosis, it sounds like definitely helpful to get referred to the right folks, and the right professionals. So, how would somebody even find a genetic counselor or try to get in to see a genetic counselor?
So, to find a genetic counselor, we have the National Society of Genetic Counseling, or NSGC. And you can actually Google NSGC, find a genetic counselor, and it will direct you to find a genetic counselor interactive site where you can put in where you're located and if you want to see a genetic counselor in person or if you prefer telehealth, and it'll help you find someone if there's someone available in your area to connect with. And so that's a really nice tool.
And we can link to that in our show notes. And I know we have already mentioned it on a few other episodes as well, so
Oh,
that's a
good.
helpful tool. Um, so a couple more questions, and and then we'll let you go. But one of the things I was curious about is you mentioned a few of the different areas you've worked in, and things that you've done in your career. What is probably the most challenging thing about working in genetic counseling?
Yeah, when I reflect on my clinical work, the hardest part is, you know, it's like what brings you joy and fills your bucket in helping patients is also what's the hardest part. And so getting to know families and getting to know their stories, you also hear their heartbreak and you hear their worry. And so that can be such a hard part of genetic counseling, or giving unexpected news to a family. You don't ever, I don't know that you ever you don't ever necessarily become an expert at it. It's so hard, but it's also really important. I tell our students too that you should always be nervous because information that you're giving impacts a family and it potentially changes their life or, leads to worry or leads to concern. And so that's a really important part. And of course, I'm reflecting on diagnoses that were really difficult where we were worried about how long we had a child or could we celebrate an eighth birthday. Those are really really difficult information to share, and that to me is probably the hardest part of being a genetic counselor.
Hmm. It can be challenging, but I think it is. I mean, you have to be still nervous, but okay, and how you give some of this news and how you give it in a thoughtful, respectful way to the family.
Yeah, I did, after giving a family really difficult information, one thing that stood out to me is somehow through that that experience, they referred to me as their angel. And
Oh.
it just caused me to reflect on that. I just thought, for the information I was giving, I was definitely, nervous and probably was even, shaky and talking through it. But then to be called an angel of just what the information, I don't know if the information or how it was given, but that makes me think about kind of what you mentioned of it is really, really hard, but perhaps genetic counselors just in our training are able to give it in a way that provides kind of that care and kindness and clarity for the families that is really important that they have.
Hmm. I think so. And I will say, I've talked to some other folks in genetic counseling who've talked about, challenging moments in their career, but also kind of have said there's this other side of it, though, that it goes along with the challenge is some of those rewarding parts. So, working with those families and at least being able to help give them information or just sit with them as they're, adjusting to this difficult news. Are there other parts of being a genetic counselor that you have found rewarding in your career?
Yeah, in a similar way, once you get to know families, it's really fun at a follow-up visit to come in and you maybe just be able to kind of talk like, oh my gosh, look at you. You've gotten so big. Like, how's it going? What are you doing in school these days? Or being shown a dance routine for someone who's in a dance class or being brought cookies by a family. And so, just as much of you can have those hard days, you can have, those joyful days too, that really do fill your bucket.
Hmm. Well, and I think that that's good to know too, especially just in the medical profession, that there are those challenges and difficult moments, but then there are also these rewarding moments where you remember why were here in the first place, and it can help kind of keep going even through those difficult, challenging times. So I know we covered a lot of different things, and talking about like related to genetic counseling, but if a person, that's hearing this, they walk away, we're not always going to remember the whole conversation. What's the one thing that you would want them to take away from the conversation today?
Yeah. Um, I think I want them to, if there's something in their family history that they have questions about, or someone in their family that they think they had a diagnosis, to ask those questions. And if they feel like they're not getting information from whoever they're asking that to really seek out a genetic counselor. And I'll add a story if there's time. So I have a good friend I've known forever who was mentioning to me that she had genetic testing, and I said, "What what kind of genetic testing you have?" She's like, "Oh, it's cancer genetic testing." And I said, "Tell me more." And so she was sharing with me a little bit more, and I said, I'd be happy to, look at your test results if that's something you're comfortable with." And she said, I didn't know you did cancer too. I just thought you did pediatrics." And I said, "Well, we're trained in everything. And so I'm happy to look at these." And so it turns out that she had shared with her doctor that her mom was positive for, breast cancer testing. So her doctor said, "Oh, yeah, we can order that." And so my friend had done BRCA1 and 2 testing, which are two genes really commonly known to cause breast cancer. And so she's like, my friend tells me, don't worry, those were negative. And so I, got a copy of her results. Her mom was willing to share her results. And turns out what her mom tested positive for was not on the testing my friend had. And so this was a really great example of a time where my friend was like, "Oh, don't worry, I'm negative," but she wasn't tested for the right thing. And so I was able to look at the two reports and say, "Hey, it looks like you can add this on for no cost. You could add on the actual, one thing that we needed to test for that her mom was positive for, and it'd be no cost if it was within a certain window." Luckily, we were have this conversation within that window. So she called her doctor and asked for that add-on test, and it came back, and then it was truly negative. But it was such an important piece where here's my friend, and we just had this casual conversation, but I worry who else out there might be so excited about their negative test result. And it's a false negative. And so they weren't tested for the right thing. And insurance was billed potentially for the wrong thing. And so that's probably my biggest worry is who might have been reassured with incorrect information. And that's such like a close to the heart story from a good friend, but it's a worry I have of people that, have questions about their family history, are given information and offer testing, do it, and it comes back negative, but it didn't quite answer the question that they had.
And I think that that's an important story. It's an important call out. It's something that, doesn't necessarily happen often, but it can happen.
Yeah.
And one of the things I know that we've talked about with some other folks on the podcast is that a genetic counselor is a specialist in genetics. So just like if you had a heart issue, you'd want to see a cardiologist because they specialize in that.
Yeah.
There are a lot of physicians that can order genetic testing, and many times it's fairly straightforward, but genetics is always evolving. It's always changing. So even for a general physician, even for somebody who specializes in something that's not genetics, it's hard to keep up with how genetics evolves and changes.
Yeah, I agree. I
Yeah.
agree.
Okay. So then I think our takeaway or our TLDR is if you're considering genetic testing, or if you have a concern about a family history or something that's going on, find a genetic counselor. Google NSGC, find a genetic counselor, go to findageneticcounselor.org and see if you can find someone. Even if they're not local, there's a lot of telehealth options these days.
Yes.
Perfect. Well, Holly, I so appreciate you spending the time with us today, and thank you for coming on the show.
Yeah, thank you so much for having me. It's been fun to talk about genetic counseling.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all episodes of the show. This link is also in the show notes for easy access. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Check out our Patreon at patreon.com/allaccessdna and consider donating to get bonus content, submit questions for our guests, and connect with other genetic curious individuals. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. Please rate and review the podcast on Apple, Spotify, or wherever you listen. This helps other people like you discover the show. All Access DNA is hosted, produced, and edited by Kate Wilson. The logo design is by Designs by NKJ. Thanks for listening, and join us next time.